Good day, everyone. My name is Warren Seow, a medical student from the University of Adelaide and a member of the Royal Adelaide Hospital Colorectal Research Group. Today, I will be presenting my systematic review and meta-analysis on the safety and efficacy of laxatives after major abdominal surgery. Recovery of gastrointestinal function after major abdominal surgery is often delayed, and this leads to postoperative ileus. This leads to significant complications and patient discomfort, doubling of healthcare expenditure, largely due to delayed postoperative hospital stay. Despite the implementation of enhanced recovery protocols recommending laxatives, the incidence of postoperative ileus remains as high as 30%. These recommendations are varied in different international protocols, and published data on the safety profile of postoperative laxatives in this setting are limited. In this study, we performed a systematic search in the listed database and included only randomized controlled trials of adult patients undergoing elective, open, or minimally invasive major abdominal surgery. Our search yielded 310 papers, and through our exclusion and inclusion criteria, we ended up with 5 randomized controlled trials. Our outcomes measure data including gastrointestinal 2. This is defined as the combination of time taken to passage of first stool and time taken to tolerance of solid food. Similarly, we measured additional outcomes such as time taken to first flatus, length of hospital stay, and postoperative complications. A total of 416 patients were included in this study, conducted across 6 countries. 196 patients were enrolled in trials using magnesium oxide as intervention, and 220 patients were enrolled in trials using bisacodyl, one of which was per rectum route of administration. Most interventions were trialed on patients with colorectal disease, with the remaining 2 on hysterectomy and 1 with liver resection. All 5 studies reported significant statistical difference in reduced time to passage of stools for laxatives as compared with the control group. However, there were no statistical difference in time to first flatus, tolerance of solid food, or length of stay between laxatives and control group. All 7 components were assessed as low risk for 3 randomized controlled trials listed above, but there are high risk of attrition bias in 2 of the remaining trials. In conclusion, routine postoperative laxatives use may result in earlier passage of stools, yet it does not influence other postoperative recovery parameters. The current data remains limited on the safety profile of laxatives, and therefore, better data is required for postoperative complications and validated outcomes measured. Thank you for listening.